we've made a lot of videos on dental implants. There's always one specific question that keeps repeating with many of our subscribers, that is regarding on immediate implants. So they always ask, what is immediate implant? Whether can I have teeth immediately, especially if it's a front tooth that we have lost, we need to replace with an implant. Can I have a tooth immediately? These are some of the questions that keeps commonly getting repeated. So I thought we'll make a video on it. This is Dr. Arun from Dentistry, running a dental centers at Chennai, Raja, Namalapuram since year 2001. If you have not yet subscribed to our channel, please do subscribe to our channel, Dentistry. We've got a whole bunch of videos coming out on dental health and awareness. So now, first let's understand what an immediate implant is. Immediate implant simply means we place a dental implant in the space that has been previously present with our natural tooth root on the same day of tooth removal. So technically, if it is within the 2 weeks is what we say, but usually it is on the same appointment. Simply put, we have a tooth that is completely broken down, that cannot be restored. It can be because of a trauma, fracture, the tooth is fractured, or it can be because of infection, the tooth cannot be restored. So the tooth cannot be restored, and then because the tooth cannot be restored, it needs to be removed or extracted. In the same sitting of tooth removal and extraction, when we plan to place an implant on the same visit, it's what is called an immediate implant. So I hope that answers the question what an immediate implant is. Now let's look at certain important things which we should consider. So for an immediate implant, a very proper diagnosis and treatment planning is very, very essential for the success of an immediate implant. Why I am saying? Because we should understand how the bone is there, whether there is any infection that is there present beyond the root, whether can we successfully remove all the infection that is there post the extraction is a very crucial question to answer. The second important thing is how much of bone that is there which can hold this implant in place is also the second important question we should answer. So once these two criteria are addressed, that is an infection, how well it can be treated, and the bone, how much of bone that is there, how much of bone that we can utilize to stabilize this implant immediately. Once we answer these two questions, then we will know whether immediate implant is a possibility or not. How we do it? Of course, we take a scan of the patient's tooth structure, we take a CBCT scan, merge these data, do a virtual planning to find out where the tooth is, where the root is, how are we planning the implant, and whether there is going to be enough bone, and how can we take care of the infection. This is a very, very important part of immediate implant treatment planning. The next important thing what we need to understand is the actual surgical process, right? So we need to use certain special piezo-surgical extraction mechanism to remove the tooth as safely as possible and ensure all the infection is clean, and then we take a surgical call whether immediate implant is possible or not, and then place the implant on the same day of tooth removal. So the third question is, which comes is whether can I have a tooth. So that again we take a certain measurements of the implant that we have placed inside, find out how stable the implant is, and then decide whether is it okay to place a tooth on the implant on the same sitting, or should we wait for the implants to heal completely before we can restore the tooth. Having said that, even though sometimes it might not be possible to place a tooth immediately on the implant, we will be able to always give a tooth as a provisional tooth, so that when patients' aesthetic demands, the social demands are met, which we can use it by using a provisional tooth attached to the adjacent teeth. So there are many methods by which we can use a provisional teeth. Hope this answers the questions on immediate implants. If there are any other questions, please do ask in the comment section below. Until next time, this is Dr. Arun from Dentistry. Bye bye and thank you.